Good afternoon, everyone. The topic of my presentation today is to assess the availability of low vision assistive products in the schools for blind in North Bihar. There's no financial interest, no conflict of interest. Introduction: education is the most important tool for social, economic, and political transformation. Schools are the place where children learn and develop many academic activities, improve their self-esteem and cognitive function. India, the second most crowded nation, is home to the whopping one-third of the world's blind. The fact is that in India, many children with disability do not enroll to schools. Such children are usually ignored and inherently neglected from going to the schools due to many reasons. The World Bank reported that children with disability in India are 5 times more ignored from going to the school than children without disability. Illiteracy rate among children with visual loss is around 80% in India. Another study from developing nations showed that literacy rate among the blind and visual impairment was low. In India, students with visual disability study in the special schools for blind. The schools for the blind are designed based on the assumption that children with visual impairment require some special additional resources for academic learning that could not be met in the mainstream or regular schools. Low vision aids or low vision assistive products are devices that aid the people with low vision and allow them to use their residual vision for better living. Low vision assistive products work by making the objects appear bigger, brighter, and blacker or more closely with improved contrast. Examples include, for reading purposes, large print books, optical magnifiers, writing, braille slate and stylus, mathematics, abacus, talking calculator, mobility, walking canes, guide canes, games, braille chess, daily living devices, color detector, talking weight machine. Materials and methods. A cross-sectional descriptive study was conducted in the 7 schools for blind in Bihar in the month of August and September 2023. The principal or the head teacher of each school was interviewed in the study about the availability of the assistive technology as well as the trained human resources. A study tool consisting of 24 assistive technologies was developed for the study. It was further subcategorized into the 7 different domains as reading, writing, math, sciences, games, mobility, and activities of daily living. A color pictorial booklet of the assistive technologies was also prepared along the study tool to avoid any confusion about terminologies of the assistive technologies during the interview. Broken assistive technologies were not included. Verbal consent was taken from the respective principal before the interview. Data management and analysis was done in the Stata 14. Data was analyzed descriptively. Confidentiality of the data was maintained throughout the study period. Anonymity of the data for school, including the availability of trained human resources per se, was maintained throughout the study period. The results are like these. The large print books available were only 2 out of the 7 schools. Optical magnifiers 5, braille reading books were 7, electronic magnifier aids were 1, typoscope was 1, braille note taker was 1, braille slate and stylus was 6, braille typewriter was 2, large print computer keyboard was 1, adapted paper was 5, tailor frame was 5, abacus 6, talking calculator was available in 4 schools, braille ruler 2, braille compass 2, braille protractor 1, walking cane 7, symbol canes 1, tactile dice 2, braille chess 2, large print games 3, audible cricket balls were only 3, color detector was in 1, talking watch in 6. This is the bar graph showing the low assistive products in the percentage form, and this is the picture showing them. Discussion: the present study reports the poor availability of assistive technologies for the visual impairment in these schools for blind. Braille materials like books and slate with stylus are widely present in these schools for the reading, writing, and training. The poor availability of the visual and tactile and sound-based assistive technologies will hinder the students in further learning or delay in cognitive development skills in the related disciplines, for example, math, sciences, games, etc. A lack of availability for children walking canes and mobility trainers will hamper the students to participate and commute to other school indoors and outdoor environments, for example, classroom, library, etc. Few probable reasons for the poor availability of the ATs are due to the lack of awareness among the teachers unable to afford for the assistive technologies or lack of productions at the local level, etc. However, further studies required to assess the factors for or reasons for the poor availability of the assistive technologies in these schools. There is a huge shortage of the trained human resources, especially for the orientation and mobility, sciences, and maths in these schools. This may be linked with the widespread lack of the assistive technologies in the schools, resulting less demands for the ATs for visual impairment. At the end, the conclusion is children with visual disability not only need assistive technology for their educational activities, but also for their future empowerment and employment. There is a widespread of lack of the assistive technology in these schools for the blind in North Bihar. Also, lack of orientation and mobility trainers in these schools will make the students difficult to manage daily movement and assessing the school facilities independently. Thank you.
It's a really good study.
Thank you, ma'am.
And one thing is, like, nowadays the normal schools have got special educators. Did you look into that?
Pardon, ma'am?
The normal schools have got special educators now. So they teach 3 days a week
No, ma'am, that was not included in the study. Only the government schools were there and the NGO-based schools were included in my study.